Our next speaker is Dr. Jing Li from Shanghai, China. He's going to present fruquintinib versus best supportive care in Chinese patients in a randomized phase 3 trial.
Good afternoon, dear Professor Axel-Gruthi, Professor John. Good afternoon, dear colleagues. On behalf of all study investigators, I'm so glad to present the fruquintinib as the study drug for this phase 3 trial as a third-line setting of metastatic colorectal cancer, the FRESCO study. Thanks to the scientific committee of ASCO to provide us this privileged opportunity. This is my disclosure. First, let's look at the burden of metastatic colorectal cancer. Globally, metastatic colorectal cancer still remains the major healthcare concern. In China, around 376,000 of new cases of colorectal cancer diagnosed each year, and it is still growing rapidly in recent years. The chemotherapy as a first-line and second-line treatment for colorectal cancer is the mainstay treatment in China. But monoclonal antibodies, including bevacizumab and cetuximab, is not common. So with that limited standard salvage therapy, so when the patients fail with second-line chemo, the third-line treatment option is high unmet clinical need. So from preclinical study, fruquintinib is an oral, potent, and highly selective VEGFR inhibitor. This is our study design. It is a multiple-center, randomized, double-blind, placebo-controlled phase 3 trial. All the recruited patients were allocated into two groups, accepting fruquintinib or the placebo. The patients were treated with 5 milligrams of drug with 3 weeks on and 1 week off in 4 weeks' time. The patients will continue the treatment until disease progression or intolerable toxicity. This study was started from December 2014, and 28 centers were involved in this study. The overall survival, it is the golden standard, was designed as this primary endpoint of FRESCO study. With the sample size of 400 patients, it should provide us the 80% of power for detecting difference between two arms at a hazard ratio of 0.7. We assuming that the median overall survival improved from 6.3 months to 9 months. The key secondary endpoints included progression-free survival, overall response rate, and disease control rate. The patient's eligibility should designed as the patients had to have the histological or cytologically diagnosed with metastatic colorectal cancer. The patients has to fail 2 prior lines of treatment with fluoropyrimidine, oxaliplatin, and irinotecan. Prior anti-VEGF or anti-EGFR targeted therapy were allowed, but not mandatory. Let's look at the demographic and baseline characteristics. All the items of the age, ethnicity, and ECOG scores are balanced between two arms, except the gender. In the fruquintinib, the female patient population is a little bit higher. And also the baseline disease characteristics showed the primary site of disease in colon and rectum are balanced between two arms, and the primary location of tumor in left or right is balanced. For stratification factor of KRAS status is virtually balanced between fruquintinib and placebo group. Due to the specific situation in China, prior use of VEGF inhibitor and prior use of EGFR inhibitor is not common. It showed that 30% of the patients and 14% of the patients exposure to these two antibodies, respectively. Now let's look at the overall survival. The Kaplan-Meier's curve from ITT population showed that the median overall survival was prolonged from 6.57 months to 9.3 months, with at a hazard ratio of 0.65 with a significant p-value. The progression-free survival showed the prolongation of the 1.84 months to 3.71. The hazard ratio was 0.26 with a significant p-value less than 0.001. Interestingly, in tumor response, the fruquintinib group, we got a complete response of 0.4%, and also we find the 4.3% of the partial response. Taken together, the overall response rate was 4.7%, and stable disease of 57.6 months. Taken together, all the patients in fruquintinib reached 32.2% in the disease control rate. The analysis of drug exposure showed as reflect to the previous slides of PFS. The relative dose intensity analysis showed the very good in the fruquintinib with the mean of 0.92 and median of 1.2. It reflects that the well tolerance. The treatment-related adverse events analysis showed that the grade 3 and 4 adverse events were increased in fruquintinib compared with placebo, and also dose interruption and dose reduction were increased in fruquintinib as 35.3% and 24.1% respectively. But the treatment discontinuation is only 15% compared with placebo 5.8%, so that is the 10% higher. The drug-related treatment analysis showed the hypertension, hand-foot skin reaction, and the proteinuria were increased in fruquintinib compared with the placebo. But it is not surprising because all this phenomenon was found in previous study from anti-angiogenesis agents. So in summary, this study met all primary and secondary endpoints at the pre-planned analysis. Fruquintinib provides the 2.7 months prolongation of overall survival with a hazard ratio of 0.65, and the progress-free survival prolonged from 1.84 to 3.71. It is a prolongation of almost 2 months with a hazard ratio of 0.26. The overall response rate increased from 0 to 4.7%. The disease control rate reached 62.2% in fruquintinib group. Acceptable safety profile from the analysis of the fruquintinib, so the most frequent grade 3 adverse events were targeted related adverse events such as hypertension, hand-foot skin reaction, and proteinuria. Grade 3 hepatic toxicities were found similar to placebo. So it is well tolerated with moderate rates of the dose interruptions and the reduction in fruquintinib group. In conclusion, fruquintinib significantly extended survival time in metastatic colorectal cancer patients who have had failed at least 2 lines of systemic therapy. Clinically meaningful and statistically significant benefits are also shown in PFS, overall response rate, and disease control rate. Fruquintinib is well tolerated in metastatic colorectal cancer patients with a good safety profile that is consistent to other fruquintinib trials and anti-angiogenesis agents. Fruquintinib demonstrated favorable risk to benefit balance in patients with metastatic colorectal cancer. We would like to thank all the participating patients and their families, and we thank all participating clinical centers. We would like to thank Hutchinson and Eli Lilly for their supporting to this study. Thank you very much for your kind attention.